Rebecca Barmherzig. I'm a neurologist with the headache program at CHOP, and I'm co-presenting with Christina Spurka as the director of the headache program at CHOP. We are hoping to just briefly go over for you some integrative treatment strategies and devices for migraine. And I think no better place to start than, what is migraine? How common is migraine? You're all here for a reason, because you're either familiar yourselves or have a family member who's familiar with migraine. And migraine is among the most common primary headache disorders that we see, affecting both children, adolescents, teenagers, and adults as well. So just some quick statistics: about 1 in every 5 women, 1 in every 16 men, and 1 in every 11 children. So more than we think. And one of the things that's really important, I guess, as a fundamental before we even talk about different treatment strategies is, why, right? What is the impetus to treat? Obviously, we want everyone to feel their best, but we also know that if migraine is not treated, there's a chance that it can get worse over time. So we really want to focus on different strategies to try to look at the young person more holistically. So not just as a headache, but all the different components that can contribute to a headache, in order to try to have the best chances possible of success. And I think that the fundamental question is there one thing that's going to fix this? And the answer is no. There is no one thing that's going to fix this. There are several things that we can do to target this problem together. And if we go on to the next slide, what you have there is a little bit of a diagram in terms of how we think about this. So when it comes to the treatment of migraine, we have almost like different layers of an onion, if you will, if you kind of picture it that way. So we think about managing all the things that can make a migraine problem worse. We think about managing migraine attacks as they're starting to spike in severity, to try to put out that spark before it becomes a flame. We think about what we can do in the background. We call these preventive treatment strategies, to try to make the brain less likely to generate recurrent headache episodes. And then we look at how we can live our healthiest life. And really integrating all of these different strategies is part of what integrative medicine is. We actually define integrative medicine as a way to approach each patient where they are, combining evidence-based strategies that take into account not only traditional Western medicine, but also the patient's mental, physical, and emotional well-being. And we look at different components. This might bring us over to the next slide. We look at different components that contribute to well-being. So things like exercise, things like our nutritional status, things about how rested we are and the quality of our sleep, things about how our behavioral health and wellness is doing. So those are all really important pieces in terms of thinking about how we can integrate a treatment approach for each individual with migraine. If we go on to the next slide, this is, how at least, I like to think about approach to treatment, because everyone's a little bit different in terms of how they visualize things. As you can see already by my hand waving, I really like to picture things in my mind. So we kind of picture trying to decrease column number 1, which is headache burden. And headache burden is this umbrella term that we use to refer to the frequency, how many headaches our brain is generating, the severity, how intense they are, and the duration, how long they're lasting for. So all of those things we refer to as headache burden, and goals of treatment are to decrease all of that, and then to increase quality of life. And quality of life has many different metrics. We think about things like function. So how are you functioning in school? Are you able to participate in hobbies and activities? Are you able to enjoy yourself participating in hobbies and activities? Are you missing out because of your headaches? Resilience, in terms of how you're able to cope with the symptoms, and then self-efficacy, taking some treatment strategies into your own hands, and really being able to have the autonomy to kind of guide your management, knowing what questions to ask and what the different steps are for yourself. So the first thing that I think of in terms of managing what makes migraine worse as part of decreasing headache burden and increasing quality of life is managing triggers. So triggers are things that we can identify that potentially can lead to or worsen a headache problem. So there are 2 main categories that I think about when I think about triggers. I think about the things that are within our control and the things that are not. And I like to focus on the things that are within our control. Things that are within our control: how much water we're drinking, what our diet is like, how active we are, how we're feeling in terms of our wellness. Things that are not in our control, things like the weather, right? We don't have much control over that, unfortunately, otherwise it would be much sunnier. And so lifestyle is, probably the most fundamental strategy we think about when it comes to working on healthy habits for headache. And it's not just making sure we're ticking all the boxes, but also that we're doing it with consistency. Consistency is really key in the migraine brain. The migraine brain is very sensitive to what we call homeostatic changes, so changes in that steady state or routine and regularity. So it's not just having the strategies in place, but also being able to maintain them with good consistency, routine, and regularity. That brings us to the next lifestyle strategy that's really important, especially for teenagers, and that's sleep. So most children and teens need between 8 and 12 hours of sleep per night. I have found it quite shocking in many families that I've worked with, particularly in the context of the transition to virtual learning, where the schedule's a little bit all over the place, that bedtime seems to be creeping later and later and later. And there's a reason that we see that more in teenagers. The sleep-wake cycle in teenagers is a little bit shifted towards preferring a later sleep time and a later wake time. But the trouble is that our school system doesn't allow for that, right? We don't have much flexibility when it comes to what time school starts in the morning and when we have to work backwards from. So really what we're focusing on is how we can make sure that we're going to bed at the right time, being able to fall asleep easily and having a restful night sleep through the night. One of the things that can be helpful with that is trying to keep that routine with consistency so the brain knows how to expect when to kind of start settling down and winding down for bedtime. Having a wind down routine can be helpful. Napping during the day can be problematic for a variety of reasons. Quality is just as important as quantity when it comes to sleep. And so oftentimes with adolescents and teens, if you're not getting enough overnight sleep, you're feeling tired after school, taking a nap, and then, bridging that until your overnight sleep. However, when you take naps during the day, your brain doesn't then cycle through all the stages of sleep as we would hope it would in your overnight sleep. And so that can sometimes disrupt how rested you're feeling the next morning, even though you may have gotten just as many hours as you would expect or perhaps more. So it's not only quantity, but also quality that's important. If we go over to the next slide, thinking about diet, so our nutrition, food is fuel for our bodies and also fuel for our brain. It's really important in young people who do experience migraine that not only, again, are they making nutritious diet choices, but also that diet is being introduced with regularity. So again, it's not just the choices, but also having that consistency. Long periods of fasting don't seem to be that conducive to that kind of headache presentation. We think that fasting can be a trigger for lots of young people for headaches. From when you go to bed at night till when you wake up in the morning is kind of your longest stretch where you're really fasting your brain. And so making sure you're having some good quality fuel to put into your body, into your brain first thing in the morning within an hour or two of waking up can be quite protective. There is no specific migraine diet. That's a question that comes up a lot. A nutritious, balanced, and varied diet seems to be what works well for most people. We think that diets high in fruits, vegetables, healthy oils, omega-3, different nutrients that have more of an anti-inflammatory effect may be protective. We're trying to learn more about this, and I think this is an area of interest that's growing. There's been more research on the role of our gut microbiome and specific anti-inflammatory factors in the diet. But this is an area where we're hoping to discover more and understand more over the coming year. So that's a watch this space. In the meantime, as I say, variety is really important. Protein is really important. We think protein is probably the highest quality fuel for our brain. So making sure that meals are protein containing, we're having some protein with breakfast, and avoiding too much sugar, too much caffeine, artificial dyes and colors. Those are general strategies that in broad strokes can be helpful. If we move on to the next slide, hydration. So I feel like I spend half my day talking with my patients and families about hydration, and I'm guilty of it just as well. This is something that's so much easier said than done. We always say drink water, drink water, drink water, but it's hard. And I think an added challenge in particular is that in young people who are attending school in person, you're wearing a mask. And so it's a little bit harder throughout the day to be sipping at your water bottle. And so we need to think about different opportunities throughout the day that we can still make sure you're getting your net hydration. About 60 to 80 ounces is what most people find is their sweet spot. Some people need a little bit more, particularly if there's a tendency towards lightheadedness. And dehydration is a really common trigger for headaches. Not everybody likes water, and that's okay. We're looking at total fluid volume. I tend to be a little bit less fussy about what my families are having as long as there's no concern for high sugar or artificial flavors, etc. Natural flavors can be a great strategy. So things like adding berries to fluids or mint, lemon, lime, etc. Excessive caffeine is something we generally try to avoid. Caffeine is actually dehydrating and has the opposite effect as non-caffeinated fluids on the body. And so if you are thinking about having a minimal or moderate amount of caffeine in your diet, so for example, your cup of coffee, that buys you 2 cups of water to make sure that you're keeping that steady state and staying hydrated. If we move on to the next slide, this is another really important thing that I think has been a particular challenge in the context of the COVID pandemic when we're all staying inside, and this is exercise, particularly over the winter. I think we're all guilty of not being outdoors as much as we would hope to. And when pain is part of your day-to-day, sometimes there can be a fear of exercise and a fear that that could be a potential worsening factor for making your headaches more severe, feeling like you really just can't get going or get started. And, you know, my best advice would be that taking the first step is the most important step because it's not all or nothing. It's maybe thinking about doing things at a different pace that fits you and how you're feeling, not necessarily doing everything or doing nothing at all. And then thinking, you know, when you don't feel like it, what might motivate you to do it anyways, and some different strategies to try to integrate that. Exercise has been scientifically shown to improve pain in many different conditions. And so it's, you know, something that we take for granted, but it can be just as important as different medication strategies. When we think about the management of migraine, it should be included as part of our day-to-day, but also making sure that we're having certain metrics to monitor how much we're doing in a week. And in addition to the benefit for pain, there's also been a lot of data looking at the benefit of exercise for mood and for anxiety as well. So that can be an important added benefit for many families. Technology, this is a tough one, particularly in the context of the pandemic and virtual learning. Screen time has skyrocketed, I feel like, over the last year. For many, not all, but many young people, prolonged screen time can be something that's irritating for the eyes, can be irritating for headaches. We think spending too much time on screen every day can have an effect on sleep as well. Oftentimes, if we're on screen, that means we're not doing other things like being outside or being physically active. So this is something just to be mindful of. I think that in the context of everything going on with virtual learning, really the attitude is let's do our best, knowing that some of the more strict parameters that we were really encouraging families to stick to pre-pandemic need to be a little bit more flexible now in the context of having to complete schoolwork. But recreational screen time, we should try to be more mindful about limiting, knowing that for many young people, this can be something that is activating from a headache perspective, can interfere with sleep. At the very least, avoiding screen time before bed. That's something that, as I say, can be activating for the brain, and making sure that we're not having those bright lights and that blue light before bed to make sure we can get into our circadian rhythm is really important as well. The next big category that we think about are nutraceuticals. So we talked a little bit about lifestyle integrative strategies, managing the things that can make migraine worse, and what are some things we can actively do in addition to those lifestyle habits that can potentially make migraine better. Nutraceuticals is the term that we use to describe different natural supplements that are used for a medical or health benefit. When it comes to migraine, different supplements work in slightly different ways, but the general principle is that these supplements act to reduce brain transmission and pain pathway hyperexcitability and to improve our energy and metabolism and have an overall anti-inflammatory effect. There are a number of different supplements that have been studied for migraine in adolescents and children and teenagers. We've listed a few that you may have read about or you may have spoke with your healthcare provider about that have some degree of evidence for support in migraine. We're going to now move on to briefly talking about manual therapies, and I believe I'll hand over to Dr. Spurka. I'm just going to mute myself.
Are you able to hear me? Yes, okay, good. Thank you. Oops. Thank you very much. And thanks to Dr. Barmherzig for putting all these beautiful slides together. So there are a few different things that we think about when we think about manual therapy. So these are, generally speaking, are things that are done to a person and are largely passive, though certainly sometimes there's an element of teaching and things that you can do essentially for yourself. So physical therapy is something that we certainly think about for patients when they have essentially pain in their neck, or a circumstance where we think that the neck is really generating headache. It's very, very common that people who have a chronic headache disorder also have pain in their neck. And essentially it's kind of a two-way street. But if there, maybe it was an injury or something like a concussion, then we particularly think about whether there might be some element of, alignment that we could be fixing, or certain strategies to strengthen the neck in different ways to avoid some of the bad postures of pain. Acupuncture, you probably have heard, essentially involves tiny needles that are used to sort of produce an anti-pain response and also a calming response. So again, is usually something that is done by an acupuncturist, a trained clinician in acupuncture. But again, oftentimes they might be able to teach you certain techniques of, specific spots in your body, specifically things like right here. There's a spot right between your first two toes that can be helpful when your headache spikes up. Massage is thought to essentially decrease inflammation and help with pain, calm down the nervous system, promote relaxation. Many patients find that it can be helpful in the short term when they have an acute spike in their pain. And then osteopathic manipulation. So there's sort of some different schools of thought in terms of the idea being alignment of the spine and how that relates to headaches. There's different types of manipulation that can be done. Some of them essentially are faster, and others are sort of slower. The amplitude, sort of the degree of the manipulation can vary. Generally speaking, we as neurologists always have a little bit of concern when someone has a very quick, aggressive manipulation, because you've got blood vessels in your neck that can tear. And there have been studies that have shown that can be detrimental to do that. Is a bit sort of gentle manipulations or sort of indirect pressure on the neck can be essentially can be very helpful. There are a number of neuromodulation devices that have come out in the past several years and have been studied for adults with migraine. There is a remote electrical neuromodulation device, which essentially is a device that goes on the arm and can be used for acute attacks of headache. There's an external trigeminal nerve stimulation, the cephalate device, essentially, which is you can put a sticker on your forehead, and then there's a little device that essentially causes almost like a buzzing sensation, which can decrease the sensation of pain. There is a vagal nerve stimulation. So we have been using vagus nerve surgeries for years for patients with epilepsy. We don't fully understand why stimulating the vagus nerve essentially can sort of retrograde up toward the brain help. But in adult patients with migraine and cluster headache, it has been helpful. And then there's a device called the transcranial magnetic stimulation device, which you sort of put over the back of the head, which is not currently available. The company that had developed and marketed that was filed for bankruptcy over last summer. And as I understand it from one of my patients who had found it very helpful, that they were in the process of being bought out by another company, and hopefully it was going to be available again at some point, but I don't know the specifics on that more recently. So these devices have all been FDA approved for the treatment of migraine in adults. It's worth knowing, though, that the bar for clearance of a device is actually a little bit lower than the bar for the clearance of a medication. For a medication, you really have to prove that it's effective, whereas for devices, generally speaking, the bar is more of a safety clearance. So both the first one, the REN, and the single pulse transcranial magnetic stimulation actually have FDA clearance in adolescents as well, from just sort of open label case series. However, the cost for all of these can be very prohibitive because they are often not covered by insurance. So this talks a little bit more about the first one, and you can see the picture where it's on her arm. Again, it's been studied for acute treatment of migraine. It's controlled by the smartphone. So the advantage of this one is that because it can be on the arm, it can be under clothing. And so if you, for example, expect to get a headache that day because of a particular expected trigger, potentially you could wear it under your shirt and turn it on in the middle of school when you need it without others knowing. It can certainly be used in conjunction with medications or can be used alone. The cost is $99 to rent it for 12 treatments. So essentially about $8 per treatment, and then has to be renewed. This is the picture of the cephally device, essentially. So it has been studied. Initially it was studied for use just acutely. Now it's got both an acute and preventive device, though it costs about $500. We have been using, this has been available actually the longest, and so we've used it in adolescents for years, but it has never formally been studied. This is the vagal nerve stimulator device. The plan was for a pediatric study, but essentially the cost of the study was too prohibitive. And so at this point, that has not yet had a pediatric study. We have, again, used it off-label in a few patients. And then this is the transcranial magnetic stimulation, which was shown as, essentially to be safe in a case series, and so was approved. But the cost is about $750 for 3 months. And again, not available right now. I think in the interest of time, it may make sense to pause there and turn over to Dina and Maya, correct? Thank you.